If your patient is experiencing sudden tightening chest pain, you can administer nitroglycerin. That would be found in Dr. Dean's office in this cart, and then you'll find it in this drawer. It should say nitroglycerin. You'll open it, and then this is where you'll find the tablets. You can give 1 tab, and then that's under their tongue, and then wait 5 minutes. And then if they're still having pain, give them another tab, wait 5 minutes. And if they're still having pain, you can give 1 more. You can give up to 3 tabs. And then if they're still having a lot of pain, then I would recommend calling 911.
If you have a diabetic patient that's experiencing insulin shock or hypoglycemia, they might report symptoms such as being cold, clammy, pale, or a forceful heartbeat. In this situation, you will want to administer glucose. So you'll come to our first aid kit, come to the section with the glucose, and you can administer them 1 entire tube. This has 15 grams of glucose. So your patient will consume the entire tube. You'll wait 15 minutes. If the patient still isn't feeling well, they can have 1 more tube. Wait 15 more minutes. If they're still not feeling well, call 911. If you have a patient experiencing anaphylactic shock, meaning their airway is closing due to a severe allergy, you'll want to administer an EpiPen. Those will be found in Dr. Dean's office in our first aid kit in this drawer labeled epinephrine, and they'll be located in a box. I'm going to use the practice pen to show you how you would administer this. First, you're going to twist off the bottom cap, take off the top cap, then you're going to push hard into the patient's thigh until you hear that click, and you'll push for 10 seconds. You will want to ask somebody to call 911 for you.
If your patient is having an allergic reaction that is not as severe as anaphylaxis, that may include something like itching, rash, or hives, then you may want to administer Benadryl. To do that, we have that in the cart. We have 3 different types. We have the adult pills, we have the chewable tabs for kids, and then we also have liquid Benadryl for kids as well. You'll want to just follow the dosing on the back for your patient. So if your patient has passed out, I would check for pulse and breathing. If they have a pulse and are breathing, you can administer ammonia. And that would be found in Dr. Dean's office in the first aid cart. So that's just right here. They'll look like this little pouch. So you'll grab one of the pouches out, you'll crack it open like a glow stick, and then you'll hold it about 4 inches from their nose.
If your patient is unconscious, they're not breathing, and they don't have a pulse, you're going to want to go ahead and start CPR. You're going to ask somebody to call 911 and ask somebody else to grab your AED for you. Your AED is going to be located in the clinic hallway. You're going to go ahead and open. You'll grab your AED, which includes the pads for an adult. There's the child size pads if you need those, and a razor if your patient has hair in the area where we're going to place the pads, and scissors if you need to cut the pads. So you'll just grab everything from this cupboard. You'll bring it towards the patient. If your patient is a different size, like a child, and you need to switch to different pads, you're just going to go ahead and pull up on this cord, and then you can place the new set of pads in there. Once you've noticed that your patient doesn't have any water on them and they're not wet, you can go ahead and place the pads where it tells you to, and you're going to push the on button, and you're going to follow all the directions that the AED tells you.
If your patient is experiencing a medical emergency, but they are still breathing, you can administer supplemental oxygen. Now to do that, you will want to grab the oxygen tank from Dr. Dean's office. It might look something like this. And then you'll want to place the mask over the patient's head and then tighten it with these 2 straps. Once that is on, you'll want to turn the oxygen tank on. So to do that, you'll want to grab this. This is just hanging off the side. Basically, you'll put it on this little notch here, and then you'll turn this counterclockwise. You'll want to hold the tank as well, and then that will turn on the oxygen.
If you have been administering supplemental oxygen to your patient and they stop breathing but they still have a pulse, you're going to go ahead and move towards positive pressure oxygen. So you're going to come to the bottom drawer, you're going to grab your positive pressure bag and mask. You're going to put the bag on the bottom. You'll put the mask on the top. And then you're gonna come and you're gonna remove the tubing from your original face mask, and you're gonna then place it on the end with the bag. Once you have attached the tubing to the end with the bag, you are going to put the face mask onto your patient. You might need somebody to help you because you want this to have a tight seal, so you might have a friend come help push. So you're going to place that mask onto the patient. You're going to turn on your oxygen tank, and then every 5 to 6 seconds you're going to do a compression on an adult, and every 3 seconds for a child. If they're still not breathing at that point, you're going to check for any obstruction, and if you don't see an obstruction, then you're going to go ahead and call 911.